Have you ever wondered about certain health conditions that affect children, especially those that might seem complex? Understanding childhood health issues, like diabetes, can sometimes feel overwhelming, but knowing the basics can be incredibly empowering. When it comes to pediatric diabetes, there are primarily three main types that affect children: type 1 diabetes, type 2 diabetes, and monogenic diabetes. While type 1 is the most common in children, it is important to recognize that it is not the only kind. The reason we distinguish between these types lies in their underlying causes and how they impact the body's ability to use sugar for energy. Type 1 diabetes is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. This means the child's body produces very little or no insulin, which is essential for glucose to enter cells. Type 2 diabetes, on the other hand, usually involves insulin resistance, meaning the body's cells do not respond effectively to insulin, often combined with an inability of the pancreas to produce enough insulin to overcome this resistance. Monogenic diabetes, a less common but significant type, is caused by a mutation in a single gene that affects insulin production or function. For parents, recognizing the signs and symptoms is a crucial first step, regardless of the type. These can include increased thirst, frequent urination, unexplained weight loss, and persistent fatigue. If you observe any of these symptoms in your child, it is vital to consult a healthcare professional. They can perform diagnostic tests, such as blood glucose level measurements and antibody tests, to determine if diabetes is present and, if so, what type it is, which guides the appropriate treatment plan. It is also worth noting that monogenic diabetes, particularly a form called maturity-onset diabetes of the young, or MODY, might be misdiagnosed as type 1 or type 2. Identifying MODY accurately often requires genetic testing because its treatment can differ significantly. Some forms respond well to oral medications rather than insulin injections. There are also other, rarer forms of pediatric diabetes, such as cystic fibrosis-related diabetes or neonatal diabetes, that are diagnosed in specific contexts. Understanding these distinct types is essential because each requires a different management approach, from insulin therapy for type 1 to lifestyle changes and medication for type 2, and specialized treatments for monogenic forms. This knowledge helps ensure your child receives the most effective and personalized care possible, leading to better health outcomes and a more positive daily life.